For decades, doctors have performed Pap tests to screen for cervical cancer. Once scientists discovered that HPV caused almost all cervical cancer, doctors also included HPV testing. However, certain barriers have prevented many women or people with a cervix from ever being screened or from being screened regularly. Those barriers may include everything from having limited access to healthcare to fear and possible discomfort associated with a speculum or pelvic exam. Other women may have experienced previous trauma, feel embarrassed, or have privacy concerns that have prevented them from getting screened for cervical cancer. Now, there is a new option, HPV Self-Collection, that may help overcome those barriers and empower women to take control of their own health. HPV Self-Collection allows women and people with a cervix to collect their own vaginal sample after receiving instructions in a healthcare setting, such as a doctor's office, clinic, or mobile screening unit. The woman positions herself comfortably and carefully inserts an approved device to collect her own sample. When she's finished, the woman gives her sample to the healthcare professional, who suspends it in a preservative solution and sends it to a lab where it's processed using the same test that's used for clinician-collected samples. As soon as the results are available, they are shared with a healthcare professional. If the HPV test comes back with a normal result, the woman is safe to return to a regular screening schedule approved by her healthcare provider. However, if the HPV test shows the presence of HPV, the healthcare provider will discuss the next steps. HPV Self-Collection gives more women the opportunity to be screened and to know whether they are at risk of developing cervical cancer, so that the disease can be found and treated early before cervical cancer has a chance to develop. Share what you know. By sharing information about HPV Self-Collection, we can help prevent cervical cancer.